Hello friends, welcome to another series. Often we see patients who present with shortness of breath, dyspnea. Along with that, the X-ray seems normal, the spirometry is inconclusive, and the oxygen saturation seems quite alright. Yet these patients continue to become breathless, and when we examine them, we find subtle signs which may give us a clue in terms of a loud P2, slight elevation of the JVP, or minimal pedal edema. This patient could be having pulmonary hypertension. Pulmonary hypertension is considered to be a rare disorder, but I don't think that's true. Pulmonary hypertension is very often missed, diagnosed late, and that's why it is considered rare by many people. It's important for us to understand that pulmonary hypertension is not a diagnosis. It's a hemodynamic syndrome which occurs because of multiple pathobiologies. So when you look at a patient or you want to approach a patient with pulmonary hypertension, it's important for us to understand what is the pathobiology behind that, and we shall try and discuss that to some extent. So it's important for us to understand that pulmonary hypertension is not synonymous with pulmonary arterial hypertension. Pulmonary arterial hypertension refers to a small subgroup in the broad umbrella of pulmonary hypertension, and we'll come to that later on. But what do we mean by pulmonary hypertension? Pulmonary hypertension is defined when the mean pulmonary artery pressure is more than 20 millimeters of mercury based on a right heart catheterization, and this is based on the new definition. The older definition had a pressure of more than 25 millimeters of mercury, but currently, because we want to pick this up early, the definition has been changed to more than 20 millimeters of mercury mean pulmonary artery pressure. Now, the important issue is to understand that when we look at classifying pulmonary hypertension, we don't do it on the basis of the severity of the disease. We try and do it more on the etiology, and we have various groups in terms of classifying pulmonary hypertension. So pulmonary hypertension is basically classified based on the WHO classification, and we have group 1, which is actually the pulmonary arterial hypertension, and it's a precapillary vascular disease. Examples being idiopathic pulmonary arterial hypertension, connective tissue related pulmonary hypertension, congenital heart disease related pulmonary arterial hypertension, and patients who have HIV or portal hypertension associated pulmonary arterial hypertension. Group 2 is the one which is predominantly related to the left heart or left heart disease, and there can be numerous causes which are leading to left ventricular failure and elevation of the pulmonary artery pressure. Group 3 is what pulmonologists more commonly see, and that is related classically to parenchymal or lung diseases or disease related to the respiratory system, common causes being COPD and ILD. Group 4 is what is known as chronic thromboembolic pulmonary hypertension, which is basically occurring in patients who have pulmonary embolism and there occurs increase in the pulmonary vascular pressure. Again, something gets missed. This is a diagnosis which gets missed, and we need to really suspect it to be able to diagnose it. Group 5 is a multifactorial, and those in which the cause is unknown. Some diseases like sarcoidosis or hematological disorders can also form group 5. So these are the various groups as far as pulmonary hypertension is concerned. We will continue and discuss more about pulmonary hypertension in the next episode. Please do stay tuned, and all the best. My best wishes. Thank you.